Today we are going to be talking about the mandibular set of forceps. In the previous two videos we have spoken at length about the parts of the forceps, the principles of use of forceps for intraalveolar extraction, and in detail about the maxillary set of forceps. Today we are going to be talking about the mandibular set of forceps. Now if you notice, the mandibular set of forceps are conspicuously fewer or less than the variety in the maxillary set of forceps. The reason for that is almost all mandibular set of forceps are unpaired, wherein they do not have a counterpart for the right and left side. The same forceps can be used on both sides. Now let's quickly dive into the actual anatomy or the structure of the forceps itself. Right out front you will notice that the mandibular forceps differs from the maxillary forceps by the direction of the beak, which is at 90 degrees to the handle. Okay, the reason for that is the ease of application. That is, you get better access to the mandibular set of teeth because of this 90-degree rotation. Now, coming to the actual mandibular anterior forceps, you will again notice that the mandibular anterior forceps is a relatively slender forceps. Sometimes it can also double up as a root piece forceps, where you are able to actually pull out root pieces by this forceps. Okay. Now, another thing to remember is the beaks of this forceps meet at the center, and like in case of the maxillary set of forceps, you have the concavity and the convexity. The concavity again has those horizontal and vertical striations which help you better grip the root of the tooth, and again the shape is such to facilitate your wedge action and to expand the socket when the actual forceps is applied. Now you have the mandibular premolar set of forceps, where the primary difference, if you notice again, is the fact that the beaks do not meet. Okay, now for other than that particular aspect where the beaks are a slightly wider variety, with the fact that they do not meet at the center, you end up in a situation where they are almost identical to the mandibular anterior forceps, with the concave part with these serrations and the convex part on the outside to help wedge the forceps into position. The reason for the increase in the width of the beak, as well as the reason why the beaks do not meet at the center, is to accommodate the larger buccolingual dimension of the premolars that have to be extracted. Now let's quickly move on to the mandibular molar forceps. Now for comparison, if you notice, it is significantly larger compared to the premolar forceps. Again, the distance between the beaks has now increased further, but a significant change is the presence of that triangular protuberance that we spoke about in the maxillary forceps. Now this triangular protuberance, mind you, is found on both the beaks. The reason for that is in the mandibular set of teeth, especially in the molars, you have the furcation area that is available both on the buccal as well as the lingual. So we can take enough mechanical advantage of the root trunk in the furcation area and grasp this particular region for better mechanical movement of the tooth. And as such, again, let's quickly look at the protuberance on both the buccal as well as the lingual beak. Now, because the furcation is present on the buccal and lingual aspect of both the right and left molars, the same forceps can be used for the right as well as the left side of the extraction. Now looking at the mandibular cowhorn forceps. Now the mandibular cowhorn forceps again has a gap in the beaks, but now there is a significant change. Now if you notice in this view, you see that the mandibular cowhorn set of forceps, the actual beak is very slender. Okay, the reason for that is that the slender beak helps you bypass the root trunk and actually take grip onto the furcation area, both buccal and lingually, and as such helps you in extracting a grossly carious tooth or a tooth which has significantly lost its coronal tooth structure. And as such, the cowhorn forceps is now used only to extract grossly carious teeth, whereas the molar forceps is used to extract intact mandibular molars. And that brings us to the end of the mandibular set of forceps. Thank you.